Welcome, and thank you for joining us today live or on the recording for episode 22 of Dr. Jeff Talks About Sex and Intimacy, Integrative Sexual Health. It means a lot to me that you've taken time out of your busy schedule to learn more about this topic. We are on social media. We're out there on Facebook, we're on YouTube, we're on X, and a special welcome to our Kick viewers. We're so excited you're here with us. Also, if you are a Facebook person, we need 100 followers on there to stream live, so please follow us on Facebook. Go to the website if you want to watch all the amazing, excellent past episodes with each of our guests. You can watch anyone you want. You can check the calendar for what's coming up next. All kinds of good things on the website. Listen to us in your car on your favorite music streaming service like Spotify, Amazon Music, Heart Radio. Wherever you are and want to listen to us, we're there with you. I want to remind you, I always like to tell you that all are welcome here. Whatever your sexual orientation, your gender identity, or your relationship style, we are so glad you're here and you are so welcome. The goal of the podcast, well, it's pretty simple. The goal of the podcast is to empower and enlighten you with the evidence-based scientific information you need to improve your sexual health, to deepen your relationship, helping you live and love more fully. Today, we're exploring how integrative approaches to sexual medicine can transform the way that we understand and treat sexual health. Sexual concerns rarely exist in isolation. They often reflect a complex interplay between hormonal, psychological, physical, relational, and even nutritional factors. That's why it's so important to take a whole health approach. One that addresses not just symptoms, but the root causes of sexual dysfunction. I am so honored and excited to be joined by Dr. Barbara Bartlik. She is a leading voice in integrative sexual medicine. We will explore how mind-body strategies, lifestyles, and functional medicine principles can support vibrant sexual health and overall well-being. So Dr. Bartlik is a board-certified psychiatrist, integrative medicine physician, and certified sex therapist with a unique background bridging psychiatry, functional medicine, and sexual health. Dr. Bartlik offers a truly holistic approach to treating sexual concerns. She served on the faculty at Weill Cornell Medical College and is a contributing author and the editor, one of the editors to the acclaimed textbook, Integrative Sexual Health. I wrote 2 of the chapters for that book, and that is how Dr. Bartlik and I know each other. She's known for her thoughtful, personalized care. Dr. Bartlik helps patients improve intimacy and pleasure by restoring balance to both body and mind. I am so excited to have you here. Welcome, Dr. Barbara Bartlik.
Thank you so much, Jeff, for that wonderful introduction and for inviting me. And I also owe a debt of thanks to you for writing those 2 excellent chapters for my book, Sexual Function and Dysfunction in Men, and also Integrative Sexual Treatment in Men. Your chapters were excellent. So, yeah.
I'm so excited that you're here, and your book, the original book, was just amazing. And I know you're working on a new book too. So I know you're going to inform us and tell us about that. But let's get started with your presentation. I'm going to let you take control, and it's all yours.
Okay. May I have the first slide? There it is. So that's just a title slide, Integrative Medicine Treatment of Sexual Problems, on Dr. Jeff's Talks About Sex and Intimacy podcast. Slide 2, please. And this is the book that we were discussing where Jeff has done 2 chapters. And so this is in Dr. Andrew Weil's Integrative Medicine Library, published by Oxford University Press. And it's a very impressive collection of different medical specialties are represented: gastroenterology, cardiology, psychiatry, and many others. Next slide, please. This just shows you the chapters, the different topics that are covered in our book. I'm not going to enumerate them for you. I want to tell you briefly how I became an integrative psychiatrist and sex therapist. And then I'll tell you why the integrative approach, I think, is essential for healing sexual problems. I graduated from Albert Einstein College of Medicine and went on to residency in psychiatry at New York University Medical Center. I studied with the pioneering sex therapist, the late Dr. Helen Singer Kaplan in Manhattan, and joined the faculty at Weill Cornell. And then I developed some health problems myself and became interested in functional medicine and integrative medicine to help me with those. I had sinus problems and I was always on antibiotics and steroids, and I was not very healthy. I was very sick, and I changed my diet, got my mercury fillings removed, and lo and behold, it's been about 25 years and I haven't had to take those medications since. The integrative medicine approach works. Going gluten-free, dairy-free is very important for reducing inflammation and helping autoimmune conditions. So I began recommending nutritional supplements to my patients, and lo and behold, they were very helpful for treating psychiatric problems, especially if a person was deficient in, say, magnesium. That can cause a great deal of anxiety, insomnia, tension, irritability. So very simple things I started with, like magnesium, omega-3, probiotics, B vitamins, and lo and behold, my patients were getting better, and that meant they needed less psychiatric medication. And that's very important for sexual health because practically all of the psychiatric medicines diminish sexual functioning. And it's a very big problem for people on psychiatric medication. Let's see the next slide. We do need more solutions for sexual problems. I want to talk to you about the problems that people are struggling with. Low libido is still a problem. It has always been a problem for women. It's the major sexual dysfunction of women. But now we have two medications for low sexual desire in women, Addii and Vyleesi. And however, they're not approved for use in postmenopausal women. So postmenopausal women have no medical solutions. The Viagra-like medicines are so excellent and so helpful for men, and I do think for women. That's my personal opinion. It hasn't been accepted as such, but I do think it helps. But half of the prescriptions that are written are not filled. So that would mean that, they're not entirely satisfactory for everybody. We need to think outside the box and find more solutions. And I think the integrative approach is the way to go. So let me tell you about some of the concerns, big concerns. Low libido is increasingly common. Women have low libido for various reasons. It may be repressed anger over their role limitations and excessive burden with home and work responsibilities, overly restrictive upbringings, concerns about attractiveness, the negative impact of so many medications, including hormonal contraceptives, dealing with the sequelae of cancer, and menopausal symptoms and vaginal symptoms. Rosemary Basson came up with a model of the sexual response that said that most women don't experience spontaneous sexual desire, but they develop sexual desire in response to their partner's initiation. But what if their partners aren't initiating? And I think today men are initiating less. studies show that the frequency of sexual interaction between men and women, married couples, or single people in relationships is at an all-time low. It decreased during the pandemic, but it was decreasing even before the pandemic, and it got worse during the pandemic, and it did not get better after the pandemic. So they're calling it the sexual recession, okay? And in the last decade, sexual activity between couples of all ages in the United States declined, especially among young adults. More young men reported no penile vaginal intercourse in a year. More couples report less sex than once a week. And we think that it might have something to do with social media and technology, as well as declining marriage rates, because married people do have more sex than single people. And men are reported to have lower libido now than in the past. There are many reasons for this: mood and anxiety disorders, chronic stress, health concerns, coping with prostate issues and cancer, using medication, changing roles and relationships between men and women, and social and economic impediments to intimate relationships. All of these problems can lower testosterone levels. Men also have more sexual outlets, such as online pornography. Many men today are less interested in forming intimate relationships with women, or maybe they're more shy about it, and this is very distressing to women. So excessive screen time may be a factor in changing couples' sexual behavior, not just because of pornography, but because screen time is taking away from other activities, like younger people are playing video games, while older people spend more time watching streaming movies and TV shows. Next slide, please. Oh, I can do it myself. Okay, yeah. Wait a second, just a second. Okay, declining testosterone levels. Okay, so it's a fact that starting at age 30, men's testosterone levels decrease about 1% per year. Testosterone levels have dropped more than 20% in the last 20 years. Now, the average testosterone level in the year 2000 was 600. In 2018, it was down to 450. That's a 25% drop. A 22-year-old man today has the testosterone level of a 67-year-old man in the year 2000. 1 in 4 men over 30 has low testosterone. Sperm counts have declined by 60% in the last 40 years, and male infertility is on the rise. Now, when you think about it, testosterone plays a very important role in men's sexual and mental health. Low T affects anxiety, insomnia, mood problems, self-esteem, vitality, energy, and more, not just sex. So what are the causes of low testosterone? This is quite a sea change. And these are some of these causes are of concern to people who are interested in integrative medicine. Next slide. Okay. So here are the, yeah, just a second. I feel like yeah, okay. I skipped, I pressed the button once, but it went twice. Okay. Here are the lifestyle-related causes of low testosterone. Exposure to endocrine disrupting chemicals such as BPA, heavy metals, parabens, phthalates, as well as antibiotics and hormones in meat. Sedentary lifestyle, lack of exercise, inadequate diet, with nutritionally depleted processed foods contributing to obesity and metabolic syndrome. Also, medications deplete micronutrients needed for hormone production and neurotransmitters. Now, this is very important. People don't realize it, but the common medications that they take reduce their micronutrients, and they need those micronutrients to have good sexual and mental health. For example, metformin depletes B12. Allergy medications deplete vitamin C. Both of those have implications for sexual functioning. I think everybody should look up their medication and find out what nutrients it depletes, and then take those nutrients to counteract the depletion caused by the medication. Another big problem, although it hasn't been definitively proven, is excessive exposure to Wi-Fi and cell phones. There are some studies that show that these will diminish testosterone, but it's not completely a fact yet. So also, people who don't respond to the typical treatments for sexual problems, they could have an underlying physiological problem, like those mentioned before. When they improve their lifestyle, lose weight, and they need less medication for their psychiatric and medical conditions, and their sexual functioning improves. So improving our health in general is the way to go. Next slide. Let's see. Yeah. You must get adequate sleep, 7 to 8 hours. You need your sleep because that's when your hormones are produced. It also helps you have better energy and mood. And believe it or not, sleep prevents weight gain. People with insomnia who don't sleep much, they weigh more and they eat more. They're hungry. They need the energy. There are many ancient traditional therapies, which we go over in my book, that can be helpful. There is some scientific evidence that they work. They are things like acupuncture, aromatherapy, Ayurveda, botanical medicine, European hydrotherapy, traditional Asian medicine, and others. Exercise is extremely important, not just for appearance and fitness, mood, weight control, and well-being. Now, the anaerobic exercise increases testosterone. That's the type of exercise where you use large muscle groups like squats and weightlifting. And actually doing a lot of exercise in that way can increase your testosterone as much as testosterone replacement therapy, if you can believe that. Yeah. And then Kegel exercises are very important for enhancing the strength of the pelvic floor in both men and women. And they improve sexual functioning across the board in both genders. Now, Dr. Lisa Pear, in episode 21 of Dr. Jeff Albaugh's series, did an excellent job discussing pelvic floor issues. I'm not going to repeat them, but I highly recommend her podcast. Yoga increases flexibility and sexual performance. That's been proven in studies. And episode 18 of this series, Kate Arima expertly demonstrates yoga exercises to strengthen the pelvic floor. The Mediterranean diet is the next thing here, and that has been shown to have sex-positive benefits, probably due to its anti-inflammatory qualities. You must eliminate nicotine and limit alcohol use. Smoking damages blood vessels, and alcohol disrupts sleep and impairs sexual performance. And then there are bioidentical hormones, such as estrogen, progesterone, testosterone, and DHEA. And I'm not talking about the synthetic forms or the kind of estrogen that's obtained from horse urine. I'm talking about bioidentical, the same kind of hormones that we have in our bodies naturally. Okay. Micronutrients. Now, these micronutrients here that I list here on this slide have been proven in research to improve sexual functioning. B6, B12, vitamin C, vitamin D. Vitamin D can actually help raise testosterone. Boron can help raise sex hormones as well. Folate. very important for reducing homocysteine, that inflammatory substance that diminishes mental health, cognitive ability, and sexual health. Iron is important. People who are anemic cannot function sexually as well as they normally could. Very important to detect anemia and to take care of it in one way or the other, nutritionally or supplements. Magnesium is my go-to medicine. I put all my patients on magnesium because most people are deficient. And unless there's some reason not to, I think it's good for most people, and it opens the blood vessels and relaxes them. Niacin is also very good for clearing out cholesterol. Sodium is sex positive, and people who limit their sodium may also have sexual problems. And they've known that since ancient times, that sodium was sex positive because they observed it in the animals that were grazing, that would sometimes go down to the sea and drink some salt water. Zinc is very important, and it actually helps in the manufacture of testosterone. And although it has not been proven to be like a definite sex positive thing, it helps when deficiencies are present. Most of these are especially helpful when deficiencies are present. The amino acids are important too. Arginine and citrulline support vasodilatation by making nitric oxide. They are precursors to nitric oxide, and that opens your blood vessels. And phenylalanine and tyrosine are precursors to dopamine. Now, this is why protein is necessary, and why when people are on a vegetarian diet, not getting enough protein, they may have some sexual problems or psychiatric problems. You need the protein to give you amino acids that will then, make neurotransmitters. And omega-3 fatty acids are extremely important for neurological functioning, cardiovascular health, and hormone metabolism. They direct your, in the case of estrogen, it directs your estrogen metabolism towards healthier metabolites. Okay, next slide. Okay, so now I'm going to talk to you about botanicals. Okay, there is some research that these are helpful, but long traditions of their use in cultures across the world. I'll just mention some of the top ones: ashwagandha, damiana, ginseng, hordegoat weed, maca, rhodiola, shilajit, and tribulus. Although when you're buying these botanicals, be careful, because there are a lot of less reputable people putting them out on the market. They may contain contaminants. Some even contain medications like Viagra. So when the person uses them, they think, oh my God, this is great. But it's not really the herb that's doing it. It's the pharmaceutical that they put in there. These products are adulterated. Sometimes up to 75% of them are. So you should be careful where you buy your supplements over the counter. I recommend going to a doctor who provides nutritional supplements and works with reputable companies, because they will know which ones are good and can be trusted. Now, CBD and cannabis are very interesting, especially now that they're legal in most states and widely available. You can get them in edibles, capsules, tinctures, lotions, lubricants, sexual lubricants, yes, and vaping. In fact, 30% of the people who use marijuana use it for sexual purposes because it heightens their sensation. CBD does not contain the hallucinogenic properties of marijuana, but it is anti-anxiety, and a lot of people use it to relax and get ready for sex. And also, my patients have been raving to me about the the effect of the lubricants that contain cannabis, that contains THC as well as CBD, and that enhances their sensation. So it's something to look into. DHEA is sex positive. That is the precursor to estrogen and testosterone in the body. It's naturally found in the body, but you can take it orally as a pill, and it will raise testosterone levels in women, or vaginally in a cream, and you can get it with or without a prescription, over the counter or through a compounding pharmacy. And oxytocin, the cuddle hormone, the one that makes a mother and a baby bond so tightly, that's available by prescription at compounding pharmacies as oral troches and nasal sprays. And that may increase sexual arousal and the ability to orgasm. Next slide. Okay. Now, I'm going to talk to you about some of the off-label compounded products. Off-label means they're not FDA approved, but you can get them by prescription at a compounding pharmacy. These are creams that can be introduced into the penis through the urethra with a small plunger, or a woman can just massage the cream into the clitoris and vulva. And these creams contain ingredients that dilate blood vessels. They may also contain hormones. So some of the ingredients in these creams for men and for women are alprostadil, arginine, the Viagra-like medications, and nitroglycerin. These all increase circulation. Something called pentoxyphylline, which is used for circulation problems in the legs, and phentolamine, another vasodilator, theophylline, which is used for asthma, but it dilates blood vessels, and vitamin B3, niacin. These are all in the creams that can be used. Now, some of them have been proven to work in scientific studies. Other of these ingredients have not been proven or have not been studied. Women use the creams DHEA, estradiol, and testosterone applied to the vulva. Okay. Also, medications, the Viagra-like medications, and also Vyleesi, which is the female sexual desire medication, they're available in melts made by compounding pharmacies that dissolve in your mouth. I think if you want to try these products out, a good way to find out what one is best is to contact a large compounding pharmacy and find out which products are most popular amongst their customers, because we really don't know. There isn't research to tell us which one is better than the other. So, but maybe these compounding pharmacists could help you out. Over-the-counter OTC moisturizers and arousal creams for women. Mostly these are not evidence-based. They've not been studied well, but they may contain combinations of lubricating, moisturizing ingredients like hyaluronic acid, vitamin E, also coconut oil, and they may contain warming ingredients like ginger and cinnamon, as well as cooling ingredients like peppermint and menthol. And what happens with the cooling ones is that after an initial chill is felt, there is then a rebound increase in blood flow, and you have increased arousal. So that's the way those creams work. They also include other ingredients, which we don't know if they work: cacao, maca, wild yam, and more. Now, Dr. Jeff and I were talking about the over-the-counter new gel available for men called Eroxon. It's FDA approved, and it works by a cooling mechanism through evaporation. It's got an alcohol-like substance that, as it cools, applied to the head of the penis, it feels cold, and then there's a rebound warming to increase penile blood flow. Okay. Now, how do you know if you have a sexual problem? Well, it can't be just an occasional thing. It has to persist and it has to cause you distress. If it doesn't cause you distress, it's not a problem. If it doesn't cause you or your partner distress, it's not a problem. And it could be a problem in any of the areas of sexual functioning, desire, arousal, erection, lubrication, orgasm, or overall satisfaction. So I like to use this very simple Arizona Sexual Experiences Scale. You can look it up. It's free online. Take the test yourself. If you get a score of 19 or higher, that suggests a sexual dysfunction. Or if you have a 5 or a 6 on any individual item, such as desire or erection or orgasm, that suggests that there's a problem in that one area. If you score 4 or higher on any 3 scales, that also suggests that there is a problem. So I brought for you today a case out of my practice I'm going to tell you about. A 39-year-old woman with severe premenstrual dysphoria. She was referred to me, and she was arguing with her husband worse during the premenstrual phase, and she was having trouble at work. She was drinking 2 glasses of wine a night to calm down. She had a history of sexual abuse in childhood by an older sibling, and from that, she developed vaginismus in her late teens, 20s, and even into her 30s. But at age 34, she overcame that problem when she received sex therapy treatment. She used vaginal dilators, and finally, she could have intercourse with her husband. However, after the birth of her child, her vaginismus returned, and she could not have intercourse for 2 years. But she and her husband remained engaged in other forms of sexual activity. Now, the treatment phase. Okay, so I did prescribe for her sertraline, which is Zoloft, the antidepressant, but only during the luteal phase in her cycle to treat her premenstrual symptoms. She began taking a detox shake with nutritional supplements designed to address female hormone balance. These included vitamin D, B6, B12, E, thiamine, folate, magnesium, curcumin, and omega-3 fatty acids. She also gave up drinking and changed her diet from what was one that was high in carbohydrates to the paleo diet, which is gluten, dairy, and sugar-free. Her premenstrual symptoms improved after 2 months, but she still had vaginismus. So I put her on 50 milligrams of Viagra orally prior to sex, which was very effective. She noticed that her vagina felt mushy, more open, relaxed, and lubricated. And after several tries, she had no pain on penetration. Now, after 4 months in treatment, she regularly engages in sexual intercourse on Viagra. Her PMS is largely gone, and she has lost 8 pounds. She's very happy. The sertraline, which is Zoloft, increases the amount of time it takes for her to achieve orgasm, but she does not find that a problem. So in this case, the dietary change and nutritional supplements that she took improved the metabolism of estrogen and reduced estrogen dominance, which is associated with premenstrual symptoms and other female problems. Although women have been taking Viagra now for decades off-label, the research on the use of Viagra in women is mixed, with some studies showing that they're effective in treating antidepressant-induced sexual dysfunction when taken orally, and others finding no efficacy. Viagra cream, when applied to the vulva, was found to be helpful in one study. In my opinion, sildenafil, oral and topical, is beneficial for women with pain on penetration. I think this special population should be studied. I do think it works in menopausal women with pain on penetration as well. And there's almost no research on this population. Now, I would like to show you a video here.
Oh. I peed. Happens to the best of us.
That's so embarrassing.
You gonna deny your mother a moment of mirth just because she got the giggle dribble? After kids, the pelvic floor can weaken, and then perimenopause reduces estrogen. Here, I have a poise.
Perfect for my leaking bladder. By the way, how did you know all that stuff?
Well, I used to be a doctor.
No, you didn't.
So here, Katherine Heigl, who was on the show Grey's Anatomy, is discussing a very common problem of older women, pee leaks or urinary incontinence. The prevalence is very high. 75% of women over 65 have this problem at one time or another. 43% of women between 50 and 65 have that. And of the women with incontinence problems, 80% are mothers. So we do think it has something to do with childbirth. In fact, I know some people who have elective C-sections because they want to preserve their pelvic floor for later in life. The causes of pelvic floor dysfunction and urinary incontinence are pregnancy, childbirth, obesity, prolonged sitting with poor posture, which puts more pressure on the pelvic floor, chronic cough, and other conditions that cause you to Valsalva, including constipation, alcohol, caffeine, and bladder infections. So, strengthening the pelvic floor muscles enhance bladder control and improve sexual functioning in men and women. And even though it's so important, many people find it very hard to do Kegel exercises. They just can't concentrate on it. They can't be consistent. The standard treatment for incontinence includes medications, which have unwanted side effects, and dry mouth, constipation, and surgeries that can have serious consequences. Both of these can interfere with your sex life. The key is to begin pelvic floor strengthening before the muscles weaken and before prolapse becomes an issue. In my opinion, young women should be taught Kegel exercises as part of physical education in high school, and they should be educated about what pelvic organ prolapse is. If they knew, they would be more likely to take preventive measures and take care of themselves to prevent this problem that occurs in aging, with menopause, when estrogen diminishes and the problem gets worse. Women should do Kegel exercises after vaginal delivery and before and after menopause and at other times. In France, the government provides free pelvic floor physical therapy after childbirth done by a nurse who comes into the woman's home. Next slide. It's not moving. I'm pressed. Technological treatments for strengthening the pelvic floor. Okay, so you see, a woman can go get physical therapy today, and she can get some of these technological treatments at physical therapy, or she can buy some of these machines herself and have them at home. One is pulse electromagnetic field therapy. This has been shown to work for incontinence and for sexual problems. A magnetic field stimulates the production of nitric oxide in the endothelial lining of blood vessels, causing them to relax and open, causing better circulation and improved oxygen delivery and healing. Also, there is a form of PEMF called high-intensity focused electromagnetic technology that delivers the electromagnetic pulses from a chair that the person, male or female, sits on, causing the pelvic floor muscles to contract. 6 treatments are usually given over 2 weeks. There is also neuromuscular electrical stimulation devices. These deliver an electrical current causing the pelvic floor muscles to contract rhythmically without effort. So you could be sitting, reading a book, talking on the phone, doing something else, and your pelvic floor could be contracting with this device. The electrodes can be placed in shorts, like tight-fitting bike shorts, or a probe can be inserted into the vagina that causes the muscles to contract, and the contractions are stronger than the person can do on their own with Kegel exercises. There are also biofeedback devices to monitor the strength of Kegel contractions, and these can be done by physical therapists. And then there is radiofrequency thermal treatment, which is usually performed by a gynecologist, where a probe delivers painless heat to the vagina, and 3 treatments are usually given a month apart to help heal the vaginal canal and external clitoral and labial tissues. So these treatments can be expensive. They often need to be repeated, and they are not covered by insurance. More information can be found on my website, pelvicfloorrescue.org. Next slide. It's not advanced. Oh, there it goes. Okay. So you can obtain integrative functional medicine training at these 3 organizations. You could even become a certified health coach in this area if you're really into it, or just become someone who is an educated consumer. The Institute for Integrative Nutrition, the Andrew Weil Center for Integrative Medicine at the University of Arizona, and the Institute for Functional Medicine. Next slide, please. Okay. So thank you so much for listening. I hope this overview gives you a sense of how integrative medicine can effectively treat sexual dysfunction. As in the case described above, a combination of traditional and alternative therapies is often the most effective approach. For example, the patient might receive recommendations for sex therapy, pharmaceuticals, nutritional supplements, compounded creams, physical exercises, and diet and lifestyle modifications. More information can be found on my website, my Instagram, YouTube, LinkedIn, and a menstrual tracking app and a mental wellness app that I'm connected to, as well as a comedy show where I host sex therapy question and answer sessions. So consider incorporating principles from integrative medicine into your life. You'll learn how to improve your health and that of your loved ones. Thank you so much for your attention, and I'm happy to answer any questions that you might have. Thank you.
Wow, thanks so much. So much good stuff packed in there. I really appreciate all that. Wow, there's just like an enormous amount of information in there, and I think it's really helpful. So thank you so much. I think that it can be challenging for our patients to navigate their way through all this stuff, right? But and so it's a trial and error thing for many of them. I know I've often told my patients, especially if they're going to try something like some of those topical things on the vulva area or the clitoris or something, I always say, here's a really important point. Try it on your arm first. Make sure you're not allergic or have some sort of strange reaction. And then if that goes well, because a rash on your arm is much more forgiving than a rash on the vulva or on the penis. So I think trying it first to kind of see how it goes on your arm, make sure you don't have any strange reactions, and then think about it. Like the things you were talking about, some things cool, some things heat. How do you feel about that? Are you adventurous? Do you want to try some of those things? And I think everybody's a little different, but navigating can be a challenge. But I do think that the wonderful thing is there's so many things out there, right?
Mm-hmm. Yeah, I often call it the kitchen sink approach. Think at it, try lots of things, because sometimes you get a little improvement with this and a little improvement with that, and they're cumulative.
And I think that multifactorial approach is really important. I find, especially like, for example, the woman who has dyspareunia or pain with penetration, and they're struggling with that. Oftentimes there's a hormonal piece or a dryness piece that has to be addressed, as well as some hypertonicity in the pelvic floor. So it often takes a multifactorial approach, and that's where a healthcare provider can really help you with guiding you in the right direction of what's going to work for you. But the best news from everything that you said is there are so many options. In this holistic way of viewing the body, there's a lot of things. Gosh, so many important things to think about. So I really appreciated everything that you presented. It was really good. I have some questions for you. The first question is, I've tried medications for low libido, but it didn't really help me much. I'm trying to get my mind re-engaged in sexual thoughts. What kinds of things do you recommend to help me with getting back to sexual thoughts after a period of abstinence?
I think that immersing yourself in erotic literature, videos is very helpful, especially if you've been through a period of abstinence. And a lot of people don't know how to fantasize. That's quite a common problem with women, not with men, but they need to be able to have a sexual fantasy and hold on to that so that can help arousal. And some women just can't do that. They've never had that. In their younger years, they fell in love, they had sex, there was no thought going through their mind. Their partner was their fantasy. They didn't need to think of something. So sometimes you have to train your mind to have a fantasy, and video can be very helpful, and erotic literature. So I refer my patients to websites that are helpful for that, and they love it.
Yeah, I think so. And there's actually science behind it. It's called bibliotherapy, and it's that's what erotica is. And I think especially I love that. I think sometimes some of my patients struggle with some of the videos because they're like, oh, then I'm compared to that, and some of it feels unrealistic. Some people are more visual, so videos are great, but definitely bibliotherapy where you're reading, you can use your own imagination about the people, the things, all those kinds of things. So and you don't have to spend a lot of money on erotica. The library is full of romance literature, and there's tons of erotica in it. So it doesn't even have to cost a lot of money.
Yeah.
So I think that's really helpful. A second question that I had from another viewer: what's one small change, just one small change that someone can make today to start improving their sexual wellness holistically?
Well, I would look at vitamins and minerals, the basics, because they do help, and they help in so many ways. And and then I would also look at changing your diet, completely getting the junk food out of your diet, especially the unhealthy seed oils, which disrupt neurological functioning. And so those are two small changes, really. And actually, they contain several changes within them. But, I think those are very important.
Yeah, I think you're right. It's like you brought up so many things like the zinc and some of the nutrients and stuff, and a lot of those you can get through a multivitamin, a good quality multivitamin. So I think you're so right. And our diet, gosh, so many things are determined by what we put in our mouth and what we eat. So two excellent suggestions. I think that's really good. We do have on July 1st. Last week we did have pelvic floor and prolapse, as you mentioned, from an expert last week, and we do have coming up July 1st another episode that will feature pelvic floor therapy, really working on pelvic floor exercises and jumping in there to do that. So I think that can be really important too. I love all the work you're doing around and all of your interest and work with pelvic floor. It's really good stuff. So that was fun to learn.
Well, if I had my way, the health insurance companies would cover the purchase of the neuromuscular treatment, as well as PEMF, and the Emsella chair, which is the high intensity PEMF, which I think women should have access to these. And
Definitely.
right now, if a woman wants to go in and get this treatment, she has to pay a lot of money out of pocket. It's not covered by insurance unless you go to a physical therapist.
Yes.
They do have some of these devices in physical therapy, but not all of them. And that can be very inconvenient, going in for physical therapy when you might as well, for $1,500, you could have some of these devices at home and do it all the time at your convenience. So I think really, since this is such a widespread problem that women have, we need more solutions. Surgery and medication are not doing it. Okay. And a lot of people are getting hurt by that. And so we should have these devices available. It should be covered.
Yeah, definitely. And, I prescribe pelvic floor physical therapy very often to my patients. I know people laugh because I know the network of pelvic floor physical therapists all around me in the Chicagoland area, and they are amazing. They do awesome work. We did have Dr. D. Hartman on, who was a pelvic floor physical therapist and has written a book and done some really wonderful work. And we'll have more because I think it's such important work. But our other editor, Janet Mendez, has said too, she chimed in and said, I hope Dr. Bartlik will mention exercise. Regular exercise, aerobic, running, and anaerobic weights can boost arousal, boost hormones. I'm Dr. B's collaborator on the book. As I said, she was. So I'm so excited that you chimed in and are here with us. Also, yoga, genital exercise as set out in Ayurveda. And so we did have, as you said, that yoga demonstration, and we'll have more yoga coming up. So look in the calendar because we have another yoga demonstration coming up as well. But I'm so glad Janet reminded us about the importance of exercise. I preach that to every patient who comes in my sexual health clinic. So I'm so glad she brought that up.
Janet, we did talk about all of those things. Well, I talked about anaerobic exercise and yoga and all that, but I did not mention aerobic exercise. And that also can increase arousal. I mean, there have been studies that show that when women exercise, like on a treadmill, they get more sexually aroused by erotic literature afterwards. They have greater lubrication. It's measurable. And exercise does help in every way, also in keeping you fit and feeling good about your body. And, and all of the mental health benefits of exercise. It's better than Prozac. You are absolutely right.
You better believe it. It's a free endorphin high. And I literally, I teach my patients, men benefit. I tell them, actually, a good friend of mine, that's at University of Michigan says there is nothing. He has a paid endowment to look at what kinds of things help sexual function, particularly erectile function in men. And he looked at it and said there's nothing like diet, exercise, and weight control. That triad is everything to a man's erectile health. So I recommend 150 to 200 minutes a week working towards that of aerobic exercise. Very, very important. So that's about 3 hours a week of your life that is spent. Your body was designed for exercise. It was designed to do that. And I'll tell you, if it's good for your heart, it's good for your penis. I tell patients it every day in my clinic. Your penis erections are all about blood flow. And so it's so important to get that exercise on the male side too. So and yes, you did an excellent job of talking about all that. And we'll be talking more about it in upcoming episodes because honestly, we can't say enough about how important exercise is to blood flow to the genitalia and normal function. Really, really important. So good stuff.
Mm-hmm.
Well, I thank you so much. We will come back. I'm going to do a little centering exercise and then I will come back to you. But I would like to, you know how we do each week here, a lot of information. And so what we'd like to do is center ourselves. I'd like to do a little whole person wellness with you. So let's take a moment like we do. Let's ground ourselves as we close today's episode. Find a comfortable position. If you feel safe, you can gently close your eyes. Let your arms drop to a comfortable position. Put your feet flat on the floor and make yourself comfortable. Take a deep breath in through your nose and exhale slowly through your mouth. Continue that slow breathing pattern as you feel your body begin to soften. Your shoulders, your jaw, your belly. Now bring your attention inward, not to fix anything or analyze anything or to judge, just to notice. Reflect on these gentle affirmations, Why is it so natural for me to feel connected to my body and my needs? Why is my sexual wellness just as important as my emotional and my physical health? Why is it safe to seek balance, pleasure, and healing at every stage of life? Take one more very slow, deep breath in and fill your lungs from the abdomen. Slowly exhale. And carry with you the intention to honor your health. There's no greater investment that you could make than in your mind, in your body, and in your heart. When you're ready, gently open your eyes. Vic, let's talk about what's coming up next week.
In episode 23, renowned urologist Dr. Kevin McVary joins Dr. Jeffrey Albaugh to demystify one of the most effective long-term solutions for erectile dysfunction, penile implant surgery. Learn who is a candidate, what the procedure involves, recovery expectations, success rates, and how it can restore confidence and intimacy for men who haven't responded to other treatments. Whether you're a patient exploring options or a clinician seeking expert insight, this episode delivers the information you need from one of the field's leading experts in sexual medicine and male health. Join us June 10th at 7 p.m. on Dr. Jeff Talks About Sex and Intimacy to learn more.
Okay, wow, that zeroed in right on. But the thing is so no options for everybody. Neither is a penile implant. But next week, we're going to unpack the good, bad, and ugly of it and talk about all of it. But this week, thank you so much for joining me. I mean, the book is amazing. The new book you're working on is going to be equally fantastic. I'm so glad you took time out of your busy schedule to just enlighten and inform the listeners. Thank you, thank you, thank you.
It was an honor, Jeff. Thank you so much for inviting me. And I think you're doing great work.
Oh, thank you. And most of all, thank all of you for tuning in, caring about your own physiologic health, your own mental health, your own whole health. Thank you for joining us and have a great one.